With early detection, breast cancer is treatable and beatable. Mammograms are the single best tool to find cancer at its earliest stages, long before it can be felt. Yet many women aren't getting them as recommended. One simple test can make a life-saving difference.
I'm going to bring it back to the dressing area here first. And have you ever had a mammogram before?
Yeah, the last one wasn't very good.
And why is that?
It was really painful.
Okay, well, I'll work with you to make sure it's not too uncomfortable for you. I'll show you the machine when we get in the room, and it's a newer machine that's been specially designed to have a little bit more comfort with the mammogram. So we'll work with it. You can communicate with me whenever you're having any pain, and we can adjust.
Okay.
So I need to have your last name first.
Waring,
And your birth date.
12/8/60.
I'm Jeannie. I'm going to do your mammogram, and there's a cape there for you on the chair. Everything off from your waist up, and put it on opening in the front. Now, are you wearing any deodorant?
Yes, I am.
So I have a wipe over there on the table. So take one of those wipes, wipe off your deodorant, because sometimes it can show up on the image.
Okay.
So just go ahead and change, and I'll be right back to get you after I get the room set up.
Okay, thank you.
And you can set your bag over here.
Okay.
Now this is the machine. I'd like you to stand in front, and I'll kind of go over it a little bit with you.
This is the part I remember, the squishy part.
Yeah. Well, now this machine has gaskets on it, so it gives a little bit when we compress today. We take 2 pictures on each breast. We'll be done here in 5 minutes. It's very quick. The images are digital, and so it goes a little bit faster than the old type of machine did. Let's swing your necklace to the back here. And what I do is I take a picture from the top like this. I'll bring your breast in, and then I turn the machine to an angle to the side for the second picture. So let's do the first one, the top one first. And you just need to let me know if it hurts in any way when I'm doing the compression. So let's open that right side up. I'm going to lift up on your right breast. And I want you to just kind of drop your shoulders. And let's rest your hand here. This right shoulder's a little high. Let's go ahead and drop that down. And I'm going to raise it just a little bit. And then we're going to bring the compression down. Now my machine is ready to shoot, so as soon as we get the maximum compression, I'm going to take your picture.
Okay.
Just try to hold very still.
Is
Okay,
that
are you
it?
doing all right?
Yeah, that's fine.
Okay, so now I'm going to go back here and shoot the picture, so hold very still. Okay.
Oh, that
That's
wasn't
one.
bad. That
Good.
wasn't anything like it was
Good,
before.
I'm glad. Okay, so we're going to do the angle view now.
Okay.
As soon as the machine gets set, I'm going to turn
Which
the
angle?
machine at an
Looking
angle. And now we're going to do the same side. So go ahead and put your right hand up on this blue bar,
Okay.
and I'm going to get behind you here and kind of rotate your body in. And I'm going to lift up on your shoulder and give one more tug so we can get all that tissue in. Okay, here comes the compression from the other direction. Now you let me know if it just doesn't feel right.
Is my chin in the way?
No, the chin is fine. Are you doing all right?
Yeah. Yeah.
Okay,
No
I'm going to
problem.
go back and shoot this picture now. Okay, how was that?
Oh, that's great. It's not,
Good.
doesn't hurt at all.
Let's go ahead and cover you up in between, and we'll do the left side in just one moment. Okay, ready for the left? Mm-hmm. And we'll go ahead and open this up. Relax your shoulders. And I'm going to lift up on this left breast. And just kind of drop your shoulders, relax your shoulders. This hand over here. And I'm going to give one more tug. Let's drop that shoulder down. And here we go with the compression on the left breast. You let me know if it's too much. That looks very good. Okay, I'm going to take this picture now. Hold still, don't move.
Why is it every time someone tells you to hold still, you feel like you're moving?
The exposure is pretty short, so we'll probably have fine pictures, but I will check them before we leave so we know there's no motion. All right, let's do the left side view now. I'm going to get underneath you, pull you forward.
I think I know what I'm doing now.
You'll forget by next year. And I'm going to lift up on your shoulder. Okay, now the compression's going to come from this direction. Ready?
Mm-hmm.
Okay, you just tell me if it hurts.
Yeah, you can compress, it doesn't hurt at all.
Good. All right, that looks very good. Shooting now, hold very still. Okay, Linda, we're all done.
All right.
Now I want to check your pictures before I send you away, so you can have a seat over here.
Okay.
And I'm going to look over your images.
When will my doctor get the results?
They should be read this afternoon by the radiologist here. Your doctor will have the results hopefully by tomorrow. You'll get a letter in the mail if everything's normal. If we need to see anything better, they'll give you a call on the phone.
Okay.
And that's usually pretty quick.
Okay.
Okay, so I need to look through your images. Okay, Linda, the position and the compression look fine. So I'm going to go ahead and send those images over to the radiologist, and you can go ahead and get dressed and go, and we'll contact you as soon as
Okay,
possible.
thank you.
You're welcome. Don't forget your purse.
Oh, yeah.
Thank you. You're welcome. You're in the first door on the right there.
Hello, Linda.
Yes.
This is Linda from the Breast Imaging Center.
Uh-huh.
You were just here yesterday for your mammogram,
Yeah.
and the radiologist wants you to come back and have some additional views, we call them.
What does that mean?
Well, it means we need to get more information. Basically, we need to get a closer look at an area in your left breast. And we use some special magnification on the mammogram machine to get those additional views. And then while you're here, the radiologist is also here. So he's reviewing the new images, giving you immediate feedback, answering any questions you have, and explaining the results.
Does this mean he thinks I have cancer?
Well, probably not, because most of the time all we need to do are get these additional views, about 80% of the time, and that's all we need, basically more information. If we do need to do anything more, we get it all done while you're here in the same day, if at all possible.
And anything more would mean?
Possibly an ultrasound exam, possibly a biopsy. But again, we really don't know until we get those additional images.
So it really could just be nothing.
Exactly.